Assalamu alaikum warahmatullahi wabarakatuh. Thank you for introducing me in Malayalam. Let me introduce about me first. Actually, I am a microbiologist. Before going to Oman, I was working as a lecturer in degree college in India. I had 5 years of experience as a microbiology lecturer. So I was teaching, and microbiology was my passion. I was very interested in teaching this subject about diseases and microorganisms, how we suffer from diseases. I got opportunity to work in Oman in 2008. So I went to Oman as a lecturer there. I worked in three different institutes like Higher College of Technology, then Al Sharqiya University, and Oman College of Nursing. In these three institutes, I had opportunity to work with the different professors belonging to medical field. So it was my area of interest as a microbiologist to learn about diseases and microorganisms. But in 3 years before, like in beginning of 2020, when COVID began, I started researching on different topics about medicine, about drugs, and how we get disease and what is the role of microorganisms. So during my research, I came across different type of books written by different type of doctors about the theories like germ theory, and there was another theory like terrain theory, which I was not aware, and this was not taught to us when we were studying in MSc microbiology. So I had different questions like about the medicine, Western medicine, like we are taking these medicines, but the number of diseases day by day they are increasing. And if medicine is helping us to cure diseases, why the number of diseases are increasing? And in the same way, if these drugs are helping us to live a better life, then why the lifespan, average lifespan of the human beings that should have increased to more than 100 years, it has decreased now? So what kind of mechanism these drugs have, and what actually they are doing in our body? In the drug
In between, I want to ask an important question.
Yes, sir.
People are taking drugs for the ailment, for the reduce the illness, but actually drugs are creating new illness.
Yes.
Then public are not aware of this. Then how do you came to understand this secret? Means drugs are increasing illness.
Yes. So if you see any medicine, with the medicine they will give the list of side effects. So a lot of side effects are already mentioned in the medicine along with the medicine. But the thing is, people are not aware of this, and it is mentioned that these side effects are very rare. So everybody will think that okay, I will not suffer from this side effect. So they ignore these side effects, and side effects can be short term, it can be long term. So after taking the medicine, we forget what medicine we have taken 6 months back. So that side effect may show up after 6 months, or it may be 1 hour. So in this way, after taking any medicine, every medicine has a side effect. So this side effect can be of short term or it can be of long term. So by the time this
Usually public are thinking we need to heal my present issue. Side effect may be appear later on.
Yeah.
Maybe it may not be appear. It may disturb me. It may hurt me. So it's usually happening.
yes.
So what is the reality behind these side effects?
The thing is, when we have any disease, the symptoms will appear, and the symptoms, when they become severe, people go for the doctor, and doctor will give medicine. That medicine is symptomatic treatment. The medicine is not curing the root cause of the disease. So because of the lifestyle, busy schedule, all the people, they want to get immediate temporary relief, and they are thinking that immediate suppression of this symptom is the cure of the disease, which is not the cure of disease. They are getting temporary relief from the present symptom, but by the time the side effect may appear, it will take few months or few years. After that, the side effect will appear, and they think that this side effect is not side effect of the medicine which I have taken long back, it is a new disease. In this
It is
way,
a new
new
disease.
diseases are coming up, and they are giving new names and new medicines. So first of all, the symptoms are treated, they are suppressed, they are not cured.
See, in the case of Kerala, in Kerala there are several microbiologists, several pharmacists, several B pharmacy, D pharmacy qualified students, and they are living in Kerala. But they never thought of the side effect. Whenever they get new illness, maybe it may be the side effect of some other drugs they used before 6 months or 1 year. So why they are not thinking this is a side effect of the drug, this new disease, and this is the real scenario we facing in Kerala.
Yes, exactly. This is what, once we finish our studies, like when we become B pharmacist or M pharma, the thing is, since I was in a teaching field, I was having a habit of reading and updating my knowledge. But the people who are working in medical shop, actually they will not get to do the research. The thing is, we have been taught in a way, and we learn the subject, and we don't see any other topic which is going against it. Many doctors are writing books, many people from the medical backgrounds are writing books which are against this medicine. They themselves were doctors, so the information is being suppressed. So if we read the books written by those doctors, they have written, for example, I can give example of one professor of medicine. He wrote The Lies I Taught in Medical School. He has written a book. And one more doctor, he wrote a book that The Lies Doctor Told Me, and myth of contagion. He himself is a doctor who has written a book.
Most of the people are thinking doctor as next to the God, next to the Almighty God.
Yes.
If you are saying doctor saying lie, and they wrote the book regarding this, what are the lie they said in their life, so it's very dangerous information. Anyway, I want to ask you some other question regarding acupuncture. So what are the benefits you see in this acupuncture?
Basically, when I came to know that Western medicine has a lot of side effects, and okay, something wrong is going on. So what is the correct way of treatment? So during my research, I came across, and I meet one of my friend. He was practicing acupuncture. So I had a discussion. I wanted to learn more about acupuncture. So what is the main difference we saw here in Western medicine and acupuncture? The thing is, we were never taught in our school or in our graduation that body can heal by itself. So this is the main difference. We are treated as a patient when we go to the hospital, and doctor will create a fear in the patient's heart, and we will blindly follow whatever the doctor says, because we are never taught in the school that our body has this ability, our immune system has a very great ability to recover from any disease. So this information is not there. So
even they are not teaching us the reality again about this healing process, self-curing mechanism. Even all of the people having experience, see, whenever a person get pain or some other health issue, they take rest, it usually come back to the normality, reversible health issues.
yes,
So they have several experience. Then even they are having this experience, why they are trusting these doctors means explanation regarding if you take drug then only you read the health issue. How they are realizing this?
the thing is, the people are not aware of the real issue. When they learn in the school, they are learning the true knowledge. For example, I will give you one example regarding vomiting. In 10th class SSC biology book, it is written that when we get vomiting, why do we get it? The body want to remove the waste and toxic substances. It is written in the book. So an educated person will understand that a waste material should be thrown out, and this is written correctly in the book that waste material is going out. But the application part, when we go for the treatment of this part, vomiting is the waste material which is going out, but doctor is giving a medicine to stop this vomiting inside our body. How can we accept this? For example, I give this example to my students that when every day the municipal people, Baldia people will come to collect the garbage, you will throw out the garbage in a dustbin and they will take it. What happens if they take that garbage and throw back in your home? Would you accept this? Then students will recognize, no, we will not accept. But why are you doing the same thing with your body? How come you accept that vomiting is a bad thing? It is written in your book. So doctor, the medicine should work in a way that more vomiting should come out to remove the more waste, but the opposite is taking place. So application part is completely wrong.
Okay.
In this way, we have to educate the people, which is not being taking place in any medical school, or I don't know if the people after learning this, they will research. If they do proper research, if they meet the people and discuss, if they are ready to hear and learn the things, they will definitely, if they are open-minded, an open-minded person can learn new things and accept that they were wrong.
Okay. See, whenever you see the acupuncture treatment, they are not taking any drugs, they are not taking any cream or lotion or any other medicine, any other part. They are using some needle on the body. This needle also drugless or something free from anything. So, what was your understanding while you taking this treatment? How it help you? What was your understanding?
My understanding regarding acupuncture from the beginning was in the biology, in anatomy, physiology, we learn and we teach that our nervous system, in our body we have nervous system which will control the body parts, all the body parts, and the nerves are spread. We have sensory nerves in our body. These sensory nerves which are spread, we call it as meridian in acupuncture, but some system is there which is having sensation. So when we prick with a needle, our body has different points which are connected with different organs in our body. So when we prick, we activate, we stimulate the point related to particular organ, and that organ, the sensation will reach the brain, and brain will start working in a way that the body starts self-healing. The brain will direct our body when we stimulate with the pin. I think in this way, and there are a lot of research regarding acupuncture where a lot of research is done, and they have been proven that acupuncture works and it stimulates the nervous system, and the nervous system will start healing our body, and it will activate our immune system, self-healing mechanism in our body. And if we read, we will get a lot of information.
Okay. Do you have any experience regarding the diabetic patient for the acupuncture?
Yes, my mother has been taking this treatment since last 1 year now. She was suffering from diabetes from last 20 to 25 years, and she was taking drugs to control the diabetes. 3-4 years before allopathic medicine, doctor suggested, she was having a wound in the left leg, and the wound was very severe, and the ultimate suggestion the doctor gave was we have to remove the 2 fingers. Some part of the finger, 2 fingers, was completely cut off. So after that, it same appeared after 1 more year, like 3 years back. Again she was having this problem, and she said, I don't want to go for the same surgery. Then luckily, it is a coincidence or it was a will from Allah that we met acupuncturist in our hometown. He suggested that without medicine we can cure it. The condition was we have to leave all those drugs. So we put trust in our
What
Allah.
was your feeling while he asking to drop all the drugs? Then only he ready to treat you. What was your feeling?
My feeling when very first time I hear that, how can it is possible? How can we leave the drugs, and these drugs are helping us to heal the body or heal the disease? How come this person is saying that we have to leave this medicine? What will happen? What kind of reaction our body will take? Will this person, the patient, will withstand this if we leave the drug? So I was not convinced at the first time when I heard, but when he had a discussion with me, I wanted to learn more. So I read a lot of information about that many people are getting cured, and he gave the testimony of many people. So I said, okay, let me try this, and once I learn about my body and how it is healing, I said, okay, we will go for the acupuncture. And Alhamdulillah, my mother had a very good result after leaving the. Of course, it was difficult psychologically for my mother to accept this, but I convinced her, and she felt better that even after leaving I can have. So she got the confidence.
What are the health issues reduced or cured through acupuncture? Can you list?
In my mother's case, there was infection in the leg. Leg was becoming red, and wound was increasing.
Diabetic wound.
And she got completely cured, and she had issue of piles. So that issue was also completely solved. And in my family, my wife was having pain in the hand, and she got completely cured. And many other patients I have seen who are getting good results. Normally, from last 2 years since I came back from the Oman, I am not going to any hospital. or any medical shop to take any medicine. So most of the diseases, like my kids, I have 3 kids, they suffer from fever, cold, cough, seasonal flus. So we are getting cured without going to any hospital. We go for acupuncture. So Alhamdulillah, we are getting the
So even if you are not taking drugs, even being as a microbiologist, how was the public response, especially your siblings or your close relatives? How they are responding even after you get this much of information, knowledge from this microbiology, and you are not taking drugs for last 2 years for even your mother, your parents, or your children? Then what was their response?
Their response was really, they got surprised because of when I discussed my niece. She is a M.Pharm gold medalist. She herself is from the same medical background. She had a lot of discussion with me, and she thinks she will try to convince others also that my uncle is microbiologist and he says this, that the drugs have side effect and acupuncture can heal. Then her friends who are doctors, they say, your uncle is very much qualified. How is he going for acupuncturist? He is an educated person. Then she came back and told me, this is the response of my friends who are doctors, they are saying. I said, because I'm educated, I'm not illiterate person. I know what is what. Let your friends read the other side of the story. I mean, I will provide the information. Let them read with open mind. Then they will understand what is happening. So many people, when I talk to them from basically my field, like microbiologist, I have many friends, they think, are you a microbiologist? I said, yes, I am a microbiologist. I know that we were not taught about the different theories except germ theory. We were taught about germ theory, and this is based on, all the medicine is based on germ theory. There were other scientists who proposed terrain theory, and it is completely opposite. So in this way, when I start discussing, they are not ready to read the books. When they read, definitely, inshallah, they will open their mind.
Okay, and what message you can give my audience? They are watching our discussion. They are worried to leave their drugs like allopathy drugs for diabetes or hypertension or thyroidism or asthma or some other joint pain like uric acid. These things, they are worried to leave their drugs. So, what message you want to tell them?
Only message I can give to the patients, the people who are thinking that it is very difficult to leave the drugs, something will happen. Everybody is worried about that we may die if we leave the drug. It will not happen. The basic living example is myself. I mean, from last 2 years. In my case, I used to take drug for every simple thing. Like if I had headache, I used to take Dolo 650 and I have to sleep for 1 hour, then only it will get cured. This was my mindset. See, there is a placebo effect in the science. How our mind thinks, the way our mind thinks, that way the body will work. So if we think that drug is healing, this is the basic mindset we have to change. So when you know the details about the drug and its side effect, you will understand that drugs are toxic to your body. Once you know this, you will trust acupuncture. Try once. Leave your drug and try once with acupuncture. Then you will have the personal experience that will help you to understand that our body has a self-healing mechanism. So inshallah, people will gradually understand.
ഓക്കെ എനിവേ ഞാൻ ഇദ്ദേഹവുമായിട്ടുള്ള ഒരു ഇംഗ്ലീഷ് കോൺവെർസേഷൻ സ്റ്റോപ്പ് ചെയ്യാണ്. ഏതായാലും വളരെ സന്തോഷമുണ്ട് ഇദ്ദേഹത്തിന് നമുക്കിവിടെ കിട്ടിയത്. ഇദ്ദേഹം ഹൈദരാബാദിൽ നിന്ന് വന്നാണ് ഇവിടെ. ഏതായാലും മരുന്ന് കഴിക്കുന്നതാണ്, മരുന്ന് കഴിക്കുന്നതിലൂടെയാണ് നമുക്ക് പരിഹാരം, രക്ഷ എന്ന് വിശ്വസിക്കുന്ന ആളുകളെ സംബന്ധിച്ച് ഇദ്ദേഹത്തിൻ്റെ വാക്കുകൾ നമുക്ക് എടുക്കാം. കാരണം മരുന്നാണ് കൂടുതൽ അപകടം, മരുന്ന് കഴിക്കാതിരിക്കലാണ് കൂടുതൽ രക്ഷ. മരുന്ന് ഒഴിവാക്കി അക്യുപങ്ക്ചറിലൂടെ ചികിത്സിക്കുന്നത് ഗുണകരമായിരിക്കുമെന്ന് അദ്ദേഹത്തിൻ്റെ അഭിപ്രായം പറഞ്ഞത് ഞാൻ എൻ്റെ ശ്രദ്ധിക്കുന്ന ആൾക്ക് വേണ്ടി ഇത് പങ്കുവെക്കുന്നു. താങ്ക് യു. അസ്സലാമു അലൈക്കും.
ജസാക്കല്ലാഹ് ഖൈർ. അസ്സലാമു അലൈക്കും.